Now, we are going to assess the legs of the patient. Throughout the leg assessment, we must note the leg active range of motion, the muscle mass, and the strength. To begin the assessment, we are going to start by assessing the vascular system of the leg. We are going to inspect the legs, observe their skin color and condition, hair distribution and toenail integrity. We are going to look for abnormalities. Then, using the back of our hands, we are going to check the temperatures of the legs from the feet. It should warm and symmetrical. Then, we are going to flex the patient's knee and compress the calf muscles against the tibia. Release the pressure and then dorsiflex the patient's foot. Next, we are going to assess the peripheral pulses in the leg of the patient. To palpate the femoral pulse, we are going to find the artery halfway between the symphysis, pubis, and anterior superior iliac spine. Then we are going to compress and release slowly. Then, locate the popliteal pulse of the patient. And bend the patient's knee and feel for the pulse in the popliteal fossa. Then palpate the patient's posterior tibial pulse. Behind and below the medial malleus and Achilles tendon. Then we are going to assess the dorsalis pedis pulse by palpating lightly lateral to the extended tendon of the great toe. Then we are going to check for edema by pressing over the tibia for 5 seconds and then release the pressure. Normally, finger pressure does not leave and pit. If it does, grade the pitting on the scale from +1 mild to +4 severe. The next thing that we are going to do is to assess the legs by evaluating their sensory function, as we did when we test the sensory function of the arms. We must assess the patient's leg for light touch, pain sensation, temperature sensation, vibration, and position. Now, we are going to assess the motor function of the patient by assessing the patient's deep tendon reflexes. First, we are going to test the quadriceps reflex. Then, we are going to position the patient with her legs relaxed and dangling over the edge of the exam table and tap her patellar tendon with the reflex hammer. The lower leg should extend and the quadriceps should contract. Next, we are going to assess the Achilles reflex. We are going to instruct the patient to bend her knee, rotate her hip outward, and dorsiflex her foot slightly, then tap the Achilles tendon. Finally, we are going to test the Babinski reflex. Then we are going to stroke the lateral aspect of the sole of the foot from the heel upward. If any of the patient's reflexes are hyperactive, we are going to check for clonus. We are going to lightly support the lower leg in one hand and dorsiflex with the other hand. Normally, we should not see extra movements or contractions in the leg. This time, we are going to evaluate the cerebral function. For the heel shin test, we are going to ask the patient to place one heel on the opposite knee and slide it down to the ankle. She should be able to do this on a straight line. Then the gait and gross motor function, wherein we are going to instruct her to walk 10 to 15 feet, turn, and walk back toward us. Her movements should be smooth and coordinated. Her arms swing freely and turn without losing a balance. And now we are going to perform the Romberg test. We are going to instruct the patient to stand with her feet together, arms at her sides and eyes closed. Stand close to her and observe for 20 seconds. She may sway slightly but does not lose her balance. Finally, we are going to assess the tandem walking of the patient. We will instruct the patient to walk heel to toe in a straight line, and she should not able to lose her balance.